Imagine this. You are sitting in a hospital room waiting for the doctor to come in. It was a tough year for you. You had pain, you felt unwell, and you're tired. You were running from doctor to doctor, but no one could really help. And then finally the doctor comes in and tells you the long-feared truth. You have a life-threatening disorder. But instead of eye contact and human connection, you get a rush diagnosis and a closed door. How would you feel? My name is Eve Huber. I'm a clinical neuroscientist and a human being. And in the past 18 years of my career, I've worked across many different sectors of the healthcare system, from research to the tech and pharmaceutical world, in hospitals and in insurances. And unfortunately, I've seen that situation far too many times. And every time, it left me heartbroken. When I was 18, I was working in a hospital. On my very second day, a patient with severe liver failure was admitted. His artery had ruptured and he was vomiting blood. I was shocked seeing that, so I turned to the nurse I was assigned the shift for, but in that critical moment, she froze. She just came back from burnout the week before, and she just looked at me and said, I don't know what to do. After what felt for me like an eternity, I could pull myself together and I was running out of the room screaming for help. And the patient was helped eventually, but it was too late and he died. I remember coming home that night and I cried. I cried for the nurse who was stretched far beyond her limits. I cried for the patient who in his very last moments didn't have comfort in human contact, but just people running around him. And I cried because I felt part of a system that doesn't really care for humans, patients and providers alike. But I want you to switch sides. Imagine you are a doctor or a nurse in such a system. You have to see 12, 15 patients, and that's just before lunchtime, while meanwhile your paperwork is stacking up, your email inbox is overflowing, and you're constantly racing against the clock. And when you go home, your mind doesn't stop, because you're always fearing that you've missed a critical thing. This is how our system does not just create burnout, but moral injury. When we look at some of the numbers, as a recent survey from the US showed that 80% of patients actually notice signs of burnout in their physician: stress, exhaustion, and lack of compassion. 70% said that they didn't feel really cared for and that this negatively impacted their care. And in Europe, it doesn't look much better. Currently, between 30 and 50% of physicians are suffering for burnout, lifetime risk, roughly 60%. And in the midst of all of that, in the midst of all of this lack of compassion, we're introducing AI and new technologies. And for many, the first thing in mind is fear. What if that technology and that AI takes what little humanity we have left in the system? But what if we got that backwards? What if actually AI and technology aren't here to replace care, but to finally bring it back? Because think about it. Our system is reactive, it's very fragmented, and we have very limited incentive on prevention and coordinated care. Meanwhile, we're measuring a lot of things, but not what really matters to the patients. And on top of all that, the costs are rising, which drives short-term goals over long-term human-centric care. My vision, and I hope I can help shape and create a human-centric healthcare system. A system that designs every layer around the needs, values, and well-beings of the people involved in that system. Such a system recognizes that we are all human beings with emotional needs and that those needs vary across the different journeys that we're going. Such a system recognizes that health needs a lifespan approach and not just a short-term fix. And such a system recognizes that AI and technology are never ends in themselves, but actually enablers towards more empathy and better decision-making. When I was in Greece some time ago, My dog suddenly fell very ill. She couldn't walk anymore, and I was fearing for her life. So I rushed her to the next vet I could find, and there something very magical happens. The vet just looked at me and looked at my dog. And after what felt like a while, he said to me, "I'm very worried for you and your dog. This is a life and death situation, but I will do the very best I can to help you and your dog." These few words gave me something no medication ever could. It gave me compassion, and most importantly, it gave me hope. But when we talk about a compassionate system, it's not just to feel nice. When we look at some of the data, we actually see that patients who feel heard and cared for, they actually have better clinical outcomes. They have less pain, they recover faster, and they have fewer complications. And some study working with terminal cancer patients even show that when those patients feel cared for, they actually live longer. So you might be asking, well, how can we go to and create such a human-centric healthcare system that you're talking about? And I want to give you today 5 approaches of what we all can do to shape such a system. The first thing, and I think that's the most critical thing, is we need to redefine goals and successes. If you look at our healthcare system today, it's very fragmented. We have the patients, we have the healthcare professionals, we have the families, we have the insurances, the policymakers, we have the tech and the pharmaceutical industry. And all of them slightly optimize for something different. Some optimize for efficiency, some optimize for revenue, some for safety, some optimize for publishing in high-impact journals, and some optimize for innovation. But the one thing that we should all agree to is that we should optimize for a human-centric healthcare system. Because research again shows when we do so, we actually also bring down the costs. Then we need to rethink what data we generate. When you think about the last time you were at your physician's, think about the questions you were asked. Typically, it focuses on symptoms. Maybe you have some blood tests that was drawn, but we can go beyond that. Sometimes in the clinic, we also use patient-reported outcome measures, which mean like, how satisfied are you? Or we ask about the pain levels. But I think we need to go way beyond that. We need to start truly human-centric data. That means we need to understand how people live, work, thrive, and find meaning in their lives, because that ultimately is what matters. When I was working in spinal cord injury research, I once had 2 patients being admitted. Both were paralyzed from the waist down. The one was recovering very well. He could walk again. He was like slightly limping, but you could barely see it with your eyes. The other one, on the other hand, he was wheelchair-bound and didn't recover much. In standard traditional measures, the walking one, that's the success story, right? But when I was talking to those 2 patients, a very different story emerged. The one that was walking, he was very depressed and emotionally not well. He was a former CEO, and he told me that he couldn't imagine going back to work because he felt disabled. He felt that he wouldn't fit in anymore. The other patient in a wheelchair, he was thriving. He was full of joy. And he told me that the accident actually made him realize what is really important in life. It's the little moments in front of us. And so when we look at those 2 patients, we're getting a very different story when we start really looking at what matters to the patients. But when we talk about data, we need to go beyond just measuring a different kind of data. We need to rethink how we use our digital footprint. Think about how you came here today and what kind of digital footprint you just created in that one day. Your swipe likes and comments on social media, your walking pattern, your commuting history, your travel preferences, but also data from your wearables, your heart rate, your sleeping patterns, and your stress level. All of that generates data day after day, which leads to a huge amount of data that we can use. Currently, however, we use that data primarily to sell it to advertisers, to make you buy stuff and to sway opinions. But what if you would use that data differently? What if you would start using that data to pick up on early flags on behavior changes and help you with specific nudges to adapt your behavior? That could mean if you feel a low mood or are slightly depressed, the algorithm actually could pick up on that and give you scientific nudges on go out for a walk, see some friends, or it could even connect you with a healthcare professional and give you other tips. This is when we would create a healthcare system that sways away from just treatment, but also fully includes prevention. Then we need to engage the patient actively. I've seen it way too many times that the patient who came to the clinic left literally their head outside because a god or goddess in white is going to make the decision for them. We need to make sure that every one of us is included and proactively takes accountability of health. That also means that we need to give the data to the patients. Because when we give the data to the patients, we actually see that they're engaged more actively. And then when we start actually engaging the patients, even way before, when we start clinical trials, we need to ask them what really matters to you in your life and include those measures ultimately to drive the outcomes that we want. And then last but not least, we need to continuously optimize care. I think all of you have experienced it at some point, that you didn't know how to navigate the complex health system that we're in. When we start continuously optimizing the pathways, it means that you get to see the right physician at the right time, getting the right diagnosis and afterwards the right treatment. And that ultimately would bring not only down the costs, it would also give time back to the physician, which ultimately means that patients, we all are going to be more happy with the system. So let's talk about the future that we all deserve, a human-centric future for healthcare. Each one of you in that room can do something and can do something right now. Think about your values, your goals, and your needs. And next time when you see a physician, communicate that proactively. Make sure that after your visit, you get the data that was acquired so that you can start thinking about the questions that you have. And then use your voice. Use your voice and support leaders and policies that actually help shape, create a human-centric system. This isn't far future. This is very well possible today. This happens if we bring care back into healthcare.